Today, we're going to talk about cancer. I've been curious about cancer since my grandma was given weeks, if not months, to live with no hope from the doctor. His advice was just go home, make yourself comfortable, prepare to die. Well, instead, she ended up living for years longer because she sought alternative treatment not offered by the doctor. The American Institute for Cancer Research reported the NIH was given $45 billion last year to research cancer, and an additional $49 billion was requested for this year. The cancer research and treatment industry is highly lucrative. So not having a cure keeps that business going. As an independent journalist, I want to keep looking just in case there is a cure that is not being promoted by those who would lose funding by solving the problem. So I was thrilled to see that Dr. Paul Marik has been looking into this himself. Dr. Marik is a co-founder of the FLCCC and is best known for his revolutionary work in developing a life-saving protocol for sepsis. He's a former tenured professor of medicine and chief of the Division of Pulmonary and Critical Care Medicine at Eastern Virginia Medical School in Norfolk. Dr. Marik has written over 500 peer-reviewed journal articles, 80 book chapters, and authored 4 critical care books. His efforts have provided him with the distinction of the second most published critical care physician in the world. He's been cited over 43,000 times in peer-reviewed publications. Dr. Marik has now come out with a review of the studies on cancer care. So with that being said, please welcome Dr. Paul Marik.
Hey, Aubrey. It's a pleasure to be with you again.
Great to be with you. Looking at your review of cancer studies, is anything missing? I'm just curious if you are seeing anything in your research that is not being promoted and used by mainstream doctors.
Absolutely. Almost everything that we've written about is being ignored by mainstream oncology and mainstream medicine because it's a big threat to them. As you said in your introduction, cancer's big business, $200 billion worth of chemotherapeutic drugs. The oncologists not only sell it, but they get paid for administering it. And so that's what they do. They give chemo. And if you're a hammer, the world looks like a nail. And so that what you're going to do is you're going to only use those therapies for which you're going to be reimbursed. And if you'll see in our monograph, I have a table which I think is quite useful, and it divides cancers into generally 3 different groups. So basically you can divide cancers into, according to the response to chemotherapy, as cancer curable, cancers which chemo improves survival, and tumors in which it's palliative only. And the chemo curable cancers make up about 5%, only about 5% of all cancers. And these are specific cancers. These are non-solid tumors. These are different types of leukemias, lymphomas, testicular cancer, ovarian germ cell tumors. So these are cancers that are actually cured by chemotherapy. Not to say that the chemotherapy itself is a carcinogen. Almost all the chemotherapy drugs, if you look at their package insert, they actually cause cancer. So what often happens with these cancer curable cancers is it's cured with chemo, but then the chemo actually causes secondary cancers, which we want to prevent. But but as you'll see from this table, most cancers actually are not curable by chemotherapy. What they can do is they can marginally prolong survival, but in many of them, all they do is increase adverse events and significantly alter the quality of life. So therefore, when patients have cancer, they need to look at this table and figure out what is the role of chemotherapy. And so, what we do is we follow a truly integrative approach, a science-based, holistic integrative approach in which we take the best of conventional medicine and the best of complementary medicine and put them together so that 1 + 1 = 3. And as we will discuss, there are many, many complementary therapies which are highly effective for the treatment of cancer. And this doesn't really matter if it's a cancer curable or incurable. They should be used across the board. However, oncologists just don't want to do it. And I'll give you just 2 examples. The first is diet. So most oncologists, when asked by the patient, what can I eat? And this happened to a patient I know last week. They'll say, you can eat anything. Diet doesn't make a difference. Eat candy, eat smoothies, eat pizza, eat what you want to. And that's completely false. And their data proves that it's false. And the reason is cancer cells are different from normal healthy cells. They are dependent almost entirely on glucose as a source of fuel. So if you go on a ketogenic diet in which you limit the amount of glucose, very, very important, you go on a ketogenic diet, you strictly limit the amount of glucose, you will starve the cancer cell to death. So diet plays a really important role. And that's the metabolic component which we emphasize. So it's a combination of metabolic therapy plus repurposed drugs. And these work synergistically. One of the pioneers in this area is Thomas Seyfried, and he showed conclusively that the combination of a ketogenic diet together with a repurposed drug kills cancer cells. It's not up for debate. It's proven in the medical literature.
What kind of repurposed drugs?
Yes, well, we'll go through the list. And so, what I want to emphasize is that it's the synergy, the combination of these approaches. And this is in peer-reviewed published literature. So our document is supported by, every statement is supported by peer-reviewed articles. There are over 900 references. And this is really important because it has to be science-based. Integrative medicine has to be science-based. Otherwise, it's nothing less than alternative medicine and snake oil medicine. It has to be supported by science. So all the recommendations we make are supported by science, and that's why we provide all the references. So in terms of the repurposed drugs, there's a long list. We kind of have whittled it down to the most effective 15. And on top of the list, you won't believe it, is vitamin D. Vitamin D actually is very potent in both preventing cancer and in the treatment. It's been well established, probably since the early 2000s, that a deficiency of vitamin D significantly increases your risk of getting cancer. And so we know as you go further from the equator, you get less ultraviolet B, you make less vitamin D, your risk of cancer goes up. And if you supplement people with vitamin D, it reduces their risk of cancer. Isn't that just such a simple thing to do? And yet doctors won't do it. This data has been available in the medical literature since the early 2000s. And yet this data, although it's there to be seen by everyone, is hidden from clear sight. So it's really a tragedy because vitamin D is so cheap, it's so safe, it's so effective for both the prevention and the treatment of cancer. The other one is melatonin. So melatonin is not just it's something you take to sleep. It is a potent antioxidant, and it works in multiple mechanisms to decrease cancer. In fact, what happens with night shift workers have low melatonin levels, and there's a really good relationship again, same as with vitamin D. Low melatonin levels increase your risk of cancer. So it was shown that women who do night shift work, mainly who work in the airline industry, those that did night shifts had an increased risk of breast cancer. So night shift work is now classified as a type 1 carcinogen. Nighttime work increases your risk of cancer. And this can be prevented by taking melatonin, available over the counter. So those are just two of the more important ones. And then there are drugs like mebendazole. So mebendazole is an anti-parasitic drug, and it's just interesting that many anti-parasitic drugs actually kill cancer cells. And in a way, simplistically, you could look at cancer cells as being parasites. And so mebendazole acts via multiple mechanisms to kill cancer cells. And together with a ketotic diet is very effective in killing cancer cells, particularly brain tumors. And brain tumors are traditionally very difficult to treat. But Dr. Ziefried has got really shown some outstanding data. The combination of mebendazole together with ketosis is really effective in killing cancer cells. And then we have green tea. Green tea is highly effective in preventing cancer and in treating cancer. We have omega-3 fatty acids, again, effective in preventing cancer and treating cancer. We have berberine, which acts via multiple mechanisms to prevent cancer and treat cancer. We have turmeric, which again has multiple mechanisms to prevent cancer and treat cancer. So you can see there's quite an impressive list of nutraceuticals and repurposed drugs that have been proven, and this is not, we're not inventing this stuff. This is in the medical literature. It's there for anyone to see. But obviously, oncologists will not discuss this with their patients because it challenges their conventional way of treating patients. And so the other thing goes to, what is the traditional thinking about the cause of cancer? So currently, the American Cancer Association and most oncologists think of cancer as a genetic disease. It's a mutation. It's due to a chromosomal disorder, and that gives rise to uncontrolled cell growth. But it appears that theory is probably not entirely correct. While genetics does play a role, it's probably not the primary cause of cancer. And so an interesting example is the BRCA1, BRCA2 gene, which predisposes women to breast and ovarian cancer. So 40 years ago, if you had BRCA1 or BRCA2, your risk of breast cancer was about 35 or 40%. Today, with the exact same genetic defect, your risk of breast cancer is like 75%. 75%. So there are obviously other factors that come into play apart from genetics. And so that's why genes may be important, but we think of cancer really as a metabolic disease. This is primarily a disease of the mitochondrion. It's a disease of energy metabolism. And that's why the cells become completely dependent on glucose, because it's a metabolic disease and you need to starve the cell of glucose. So it is somewhat of a paradigm shift. And so if the theory that you have of the cause of something is false, then the treatment which is based on those theories is likely also to be false. And so that's the likely situation. And so you can see this idea is turning the tables on the conventional view of cancer, of what causes it and how to treat it.
Wow, that's incredible. So vitamin D being one of the top things to treat cancer. When you look at these studies that indicate that, how were people getting vitamin D? What was the best way to get it?
Yeah, so, if you speak to Dr. McCullough, he thinks the best way is to run around naked in the sun. Now, obviously, for most of us, that's not a feasible thing to do. But in reality, if you spend and it depends where you live. If you live close to the equator, you can probably do it. You need to spend about 20 minutes in the sun. And obviously, you don't want to put sunscreens on because it blocks the UV rays, which you need to make vitamin D. So if you're fortunate to live, closer to the equator, in a tropical area, then you can go outdoors midday, 20 minutes and get some sunshine. And probably the best would be to go for a good walk. So you're getting the benefits of walking and sunshine. But for most people, that's not practical. So the other way is just to take vitamin D3 supplements, which are completely safe, highly effective. So let me say that again, vitamin D3. And so the traditional dosing is completely and utterly inappropriate. The recommended daily allowance is 600 units or 800 if you're a little bit older, which is completely absurd. We recommend a dose of 5,000 at least, but likely more like 10,000 for prevention of cancer. And so a dose of 10,000 is perfectly safe. It can be taken chronically with no risk of adverse events. And if you do take vitamin D3 in that dose, we do recommend to take it together with vitamin K2. We don't recommend vitamin D2. So some people take vitamin D2, which is derived from yeasts. Vitamin D2 is about a third as effective as vitamin D3. The other thing about vitamin D is you need to take it daily rather than taking one big dose once a week or once a month. So the way you dose is important. In patients who have cancer, we actually use a much higher dose. So we recommend a dose of at least 10,000 to 20,000 to 30,000, really based on their blood levels. So if you do have cancer, you want to push the level to about 100 to 150. And so it becomes important to monitor the vitamin D level, which is completely goes against the current recommendation, which suggests a vitamin D level above 20 is fine. We think that's grossly underdosing. So that's vitamin D. It's actually a hormone. It acts on multiple cells via multiple genes. It improves the immune system. So likely the benefit in patients with cancer is it activates your immunity, which helps to kill the cancer cell, which is really the opposite of what chemo does. Chemo wipes out your bone marrow and destroys your immune system, so your body can't fight the cancer. And so vitamin D and melatonin and all these other nutraceuticals act to actually improve the host's immune system.
Fascinating. So in my grandma's story, she actually switched to a completely alkaline, raw vegan diet, which is not keto, but I think it was eliminating the glucose. She was just eating raw alkaline veggies. If you look at the acid versus alkaline profile of the plant, she was eating the most alkaline plants, in addition to decreasing stress, really focusing on filling her day with things that made her laugh and not talking about things that made her worried. And that was the main thing, the diet change and the focus of her thoughts. So how does that square up with your research?
Yeah. So what you say about stress is really important. Stress, believe it or not, increases your risk of cancer. And if you have cancer and you're very stressed, it decreases your life expectancy. So stress management, treatment of anxiety, treatment of stress is really, really important. And the other is sleep. Good sleep, sleep deprivation increases your risk of cancer. So you want people to have at least 7 hours, 8 hours of good restful sleep, and exercise. So, it's a lifestyle change. So this is not running a marathon. This is just, going for a walk, doing some form of exercise, doing something which releases stress, doing lifestyle changes which improve sleep, and then obviously diet. So, we don't absolutely recommend a vegan diet, but a vegan diet obviously will reduce processed carbohydrates. The enemy of cancer is processed carbohydrates, processed food, because it's so high in glucose and fructose and all kinds of synthetic chemicals. So the fact that she was on a vegan diet probably did play a major role, because she was
on a raw vegan diet, which is dramatically different than vegan, because technically I'm vegan. You can eat donuts, vegan. I think vegan might actually cause more cancer because you're not, you're filling your calories all with carbs.
Yeah,
So
so I think you're right. A vegetable vegan diet is probably an exceedingly healthy diet as long as you get sufficient protein, because it's really the processed food. So you're absolutely right. The fact that someone's vegan doesn't mean that it's a healthy diet, because they could just substitute meat products with unhealthy processed foods. So it sounds like what you was doing was a exceedingly healthy, vegan vegetable diet, which is obviously low in processed foods.
and it's interesting that your research indicates that ketogenic is cancer killing. I mean, that's just a high meat, high fat diet, right?
Yes, so paradoxically, a diet low in carbs but high in fats, including saturated fat and moderate protein, seems to be quite good in killing cancer. So there's this hoax about saturated fat and saturated fat causing heart disease, and people taking statin. That is a pharmaceutical diet industry hoax. Saturated fats are perfectly healthy and fine. So eating eggs and bacon and meat is fine as long as it's uh, fresh, organic, farm raised, not corn raised, animals that are not fed corn, that these are grass fed animals, so that they have healthy protein. Um,
Now, you spent many years in critical care, as I described in the beginning. Now, when patients are critically ill, they're completely dependent on a diet given to them by the hospital. What's in that diet, and who decides?
yeah, so
What
that's really an interesting question, and there's kind of been an evolution in our understanding. So most, most mammals, when they're sick, they lose their appetite. And that's a really good thing, because it switches on a process called autophagy, which is something else we recommend, is daily intermittent fasting. And so when patients lose their appetite, it's actually a good thing. And so the worst thing you can do in an acutely ill patient is put down a feeding tube and feed them with a nutritional compound that's high in glucose and fructose and processed food.
I was
Which
gonna say, isn't there glucose in that feeding tube? It's basically sugar water.
Exactly. So unfortunately, that's what happens when you acutely ill. So so a few days of starvation is fine, and then you should allow patients just to recover. And once they get their appetite back, let them eat what they want to eat, and let them eat food. Real food, not processed food. Unfortunately, those patients who remain critically ill for a longer period of time, after 4 or 5 days, you need to feed them, but you want to kind of feed them the healthiest diet you can. And you want to do it intermittently, not the way that humans eat, not continuous tube feeding. So, although it's off the topic a little bit, because, from cancer, you're absolutely right. The way critically ill patients and the way hospitalized patients are fed doesn't make any sense. You would imagine that these are the sickest, most vulnerable people, and you want to give them a healthy diet. And often that's not the case.
Wow. Um, I'm just wondering, we talked about big business meeting. I'm just trying to understand why it seems so backwards. You're saying the research shows, peer-reviewed studies show that changing your diet is dramatically helpful, yet the hospitals are feeding the patients exactly what's killing them. I mean, what wouldn't individual doctors figure this out on their own if the institution's not telling them to do this? I understand cancer is big business for the hospital, but maybe individual doctors have a say, or how is it that across the board cancer is treated in such an ineffective way, causing it to be one of the top killers of Americans?
Yeah, well, that's a big question. I suppose the big thing is cancer's big money. It's a big industry. And so what we're suggesting is cheap, Going on a ketogenic diet is cheap. Getting sunshine, you can't put a patent on sunshine, so it's cheap. Most of all of the repurposed drugs are cheap. The nutraceuticals are cheap. So this is very threatening to the bottom line. Secondly, most dietitians are completely indoctrinated into the USDA and the Dietary Association falsehoods in terms of causation of disease and the role of diet. So this is no different to COVID. It's the remarkable degree of brainwashing that dietitians and hospital physicians undergo. Hospital physicians know almost nothing about nutrition. When I say almost nothing, probably nothing. In terms of, complementary or supplementary medications and repurposed drugs, they know nothing. When I say nothing, they know nothing. So that they basically taught the standard narrative. They follow big pharma. And so unfortunately, there are some enlightened physicians, and hopefully this is more of a growing trend with truly integrative physicians that can incorporate the best of conventional medicine plus complementary medicine and really be patient focused, focus around the patient, like your grandma. What does grandma want? Why don't we do what grandma wants rather than what the doctor wants?
Well, she still wanted to keep eating her donuts, but it was actually my aunt and my mom who said, we've researched this and we think if you switch what you eat, it'll help. So she begrudgingly did, and then she had dramatic improvement. The doctors were shocked. Now, in your review here, you said that you recommend consulting with a regular oncologist and an integrative provider.
Yeah, so that's we live in the real world, and so patients are going to see oncologists. One's wish and one's hope is that these are enlightened oncologists, and so sometimes the patients actually have to educate their doctors. And so what I would suggest is that patients give a monograph to their oncologist. Let them read it. Let them open their eyes. Let them open the window to science and truth. And so the ideal world would be an oncologist who is willing to accept these, supplementary or complementary approaches. We're not saying throw away all the oncology, throw away all the chemo. Chemo does have a role, but it's not the only answer. And so I think an integrative approach where you combine the best of both worlds is ideal. Now, unfortunately, I think many oncologists, because of political pressure, economic pressure, are just so close-minded. So if that's not going to work, then I think the patient needs to try and find an integrative physician who can help them alongside the oncologist. I think it's difficult for a patient to do alone. They can do it alone if they're really motivated, but I think it makes it a lot easier if they have an integrative physician who can help them.
If someone is really advanced in their cancer, what do you recommend? Because you mentioned things like vitamin D and green tea, but is there something more?
Yeah, so I think that you never need to give up hope. We know of patients who were so-called at death's door, who were given weeks to live, who've survived 10, 15 years. And so we hear more and more of those stories. So I think if there's life, there's hope. If there's hope, you can do things. And I think the more advanced the disease, the more aggressive it is, the more aggressive the treatment should be. You may need 5, 6, 7 of our repurposed drugs all taken together, so in a more aggressive protocol. So I think, one should not give up, that there is hope, and that many of these therapies seem to be quite effective. And so I would urge people to read our monograph. They can download it from our website at
flccc.net, right?
At flccc.net. They can download it. They should read it. They should share it with family members and give it to their physician. It's science-based. It's all science-based. And the good news is that we will have this available through Amazon. within the coming weeks as both a Kindle version and a book. So that should make it even more accessible.
I was gonna say you call it a review of studies, but it looks like a full book. Um, it's very dense. Thank you so much for looking into this and reading the studies that so many won't read. I know that the pandemic was an eye opener for a lot of people in regards to doctors being in lockstep with the medical establishment having little say in treatment. And so cancer has been something I've been very curious about for a while. I really appreciate what you're doing to shine light on this topic. Is there any last things you want to say?
Yeah, no, just thank you. I think people should need to empower themselves. I think the days are done where doctors follow this, paternalistic approach where they dictate therapy. It has to be patient-centered, and patients have choices and options, and they need to be empowered and hopefully have a discussion with their doctor. If their doctors won't have a discussion with them, my advice is find a new doctor. You know, you need to be able to have a patient-physician communication relationship where they each listen to each other and communicate. I think that's just so important.
I think there's been quite a peer pressure propaganda campaign as well to say that anything that's not chemo or radiation is quackery, right? And so here you bring together peer-reviewed research, actual science that says the opposite. It's not quackery when it's scientifically studied. So guys, look for, let me see if I can bring this on the screen here. Here, look for this. Go to flccc.net. Look for Cancer Care. This is his review of the science on what's really working for treating cancer. And does flccc.net connect people with practitioners that might actually be open to treating patients?
So, we don't do that. We do have a list of directories, but what I would suggest is people read the monograph. And then if you go to Dr. Google, Google an integrative oncologist or an integrative physician in your area. That's probably the best. Or ask around. There are surprisingly quite a lot of integrative oncologists or integrative clinicians, and find one in your area and take them the monograph and have a discussion with them.
Perfect. Sounds great. Thank you so much, Dr. Paul Merrick. Appreciate you.
Thank you so much, Ivory Hacker.
All right. Talk to you later.
See you.